In our previous videos, we actually looked at most of the axial skeleton and introduced the appendicular skeleton and looked at some of the general or major parts of it. So what we're going to do with these last videos is we're going to actually fill in the blanks according to the structure list. Now, the structure list that you saw on the two previous videos were from another class, and they included a lot of the things here, but they weren't as inclusive as this list is. So this is your official list, but we may have already, we already included talking about, say, the humerus and the head, so I will briefly talk about them now. What we didn't talk about in the previous videos are things like the anatomical and surgical neck, so I'm going to fill in the blanks here that we didn't go into as much detail on the previous videos. So let's go ahead and look at this upper arm again, of course called the humerus, and let's talk about these parts of the upper arm, including the head, the anatomical and surgical necks, the greater and lesser tubercles, the intertubercular sulcus, and the deltoid tuberosity. Then we'll look at some of these other parts. Again, we're looking at the upper arm bone, the humerus. We see the head is like the ball of the ball and socket joint. That's what fits into the glenoid fossa that we found on the scapula we talked about earlier. Now, we actually have, below everybody's head, you have a neck. Well, we have two kind of necks here. We have what's called an anatomical neck, which is more like a suture line, almost right where the head ends. And then we have what we call the surgical neck, which is where this upper portion slims down to the shaft of the bone. Okay, so anatomical neck, more the suture line surrounding the head. Surgical neck, more where this upper portion becomes the shaft of the rest of the bone. Okay, another thing on here that we can see is a little bit of an enlarged area. The tuberosity is an enlarged attachment area on the bone. So our deltoid, our shoulder muscle, is actually going to tie into the humerus right in that slightly enlarged area, the deltoid tuberosity. It's not real prominent, but it is a slightly enlarged area, about a third of the way down, almost halfway down the shaft of the bone. Okay, now up close to the head, we have two really important attachment sites, the greater and lesser tubercles. Now, they're not called greater or lesser because of their size. They're called greater and lesser because of their actual location. The greater tubercle is a little bit higher up, as we can see here. The lesser tubercle is a little bit further down. And then we have a groove or sulcus, which you can call it either one. It's called the inter always means between. Intertubercular sulcus or intertubercular groove is the groove that is found between the greater tubercle and the lesser tubercle. Now, more towards the bottom of our humerus, we're going to actually have our trochlea and capitulum, which are actually names of our condyle. Now, remember, condyle is a rounded place where two bones articulate. So where the humerus is going to articulate with the radius and ulna is going to be down here at the trochlea and capitulum. And then, since they are condyles, they're going to have little areas called epicondyles that are kind of coming off of the condyles. And then, of course, we're going to have fossas, which are depressions. So let's look at these. Now, again, looking basically at the anterior, the front of the bone from the anatomical position, and keep in mind anatomical position is standing upright with your palms facing forward. Okay, looking at the anterior surface, notice that I have these condyles, this area down here where we're going to articulate with the bones below it. And on the medial side, because remember the head is always pointing inward, so anything towards the middle is the medial side, we're actually going to have the trochlea here, which kind of has these two, it's the larger of the two, and it's got this more sharp pointed area. Then I'm going to have the trochlea. On the more rounded lateral side, I've got this area called the capitulum. Again, both of those are condyles. So if this is a condyle, and this is the lateral side, and this is the medial side, then this big area coming off the medial side, the medial condyle, which is the trochlea, is going to be the medial epicondyle. This is basically where what you call your funny bone is. We got that nerve inside there, and when we hit it, it sends that really fun pain down the arm. So if you tap on the inside of your elbow region, you're tapping on your medial epicondyle right there. So that means that this little protrusion on this side, which they don't tag it here, but that little protrusion off the side of the capitulum is actually going to be your lateral epicondyle. So, well, I guess they are tagging it right here. So lateral condyle off the capitulum, medial epicondyle off the trochlea. So lateral epicondyle, this bump on the bump, medial epicondyle, this bigger bump off of this condyle, this area that's actually articulating. Now, this doesn't articulate, this doesn't articulate. They are attachment sites. Okay, we have these three fossas, these three depressions, because they're going to actually allow bones to kind of slide into these depressions so we can, our forearm bones in relationship to our humerus. Okay, looking at our largest fossa, the olecranon fossa, the olecranon process, or the elbow, fits in there. So again, this is the posterior. You know your elbow is on the back of your arm from the anatomical position. So we need a space for the elbow so the lower arm can articulate with the upper arm. So we have this big depression in the back. So that's actually going to be our olecranon fossa. But on the front, we've actually got our coronoid process, the front portion of that elbow area, which will actually fit into this depression. And then, of course, our other lower arm bone, the smaller of the two, the radius, needs a place to articulate. So the radius slides over the capitulum, and this very slight depression here is where the radius would fit. Okay, so again, the radius would fit in the radial fossa. The ulna is going to basically fit in both the coronoid and olecranon fossa, because the olecranon process will fit in the olecranon fossa. The coronoid process will fit in the coronoid fossa because they are articulating with each other. Okay, so let's look at the radius and the ulna and look at these specific parts. Okay, here we see the two lower arm bones, the ulna from the posterior view and the radius. And here we see the ulna from the anterior view and the radius. The radius looks kind of like a nail, kind of has like the head of a nail and then the sharp point of a nail. The ulna looks almost like a wrench because it's got that notch in it right there. Okay, so let's look at the parts of these, and let's start with the radius first. Okay, so like we said, the top of the radius, which is kind of flat, but it has is the head, and this is the part that will be articulating with the humerus. The bottom part of the radius has a sharp point to it, and that is called a styloid process. We talked about a sharp point in the temporal bone called a styloid process. So this is the sharp point on the radius, which is a styloid process. Okay, now we have this enlarged connective area near the head. That's the radial tuberosity. Now notice I can kind of see, it's hard for me to see it from the posterior view, but from the anterior view, I can see that area. It's very prominent as far as if you were to pick the bone up, you would see this portion kind of sticking out here from the rest of the longer portion of the radius. So radial tuberosity. So I've got the head, the radial tuberosity, I've got the styloid process, and then where the actual radius and ulna come together, I actually have the ulnar notch down here on the opposite side of the styloid process of the radius. So the ulna is going to fit on the opposite side of the styloid process within a little notched area called the ulnar notch. Now, the reason why we call it the ulnar notch is because it's on, again, the radius. If it were called the radial notch, then it would be on the ulna, as we're going to see. And of course, we usually have an enlarged area called a head, and then a slender area below the head called the neck. So we have the neck of the radius below the head of the radius. So again, looking at the radius, we had the thickened area below the head called the radial tuberosity, the thin area directly below the head called the neck, the ulnar notch, the area on the opposite side of the styloid process that the ulna would fit next to the radius, and then of course the styloid process, the sharp point coming off the radius. Now let's look at the ulna. Of course, the ulna has the olecranon and coronoid process, which we said earlier fits into the coronoid and olecranon fossas. Okay, so it also has a head, but it's on the opposite side of the head of the radius, and it also has a styloid process, which will again be a sharp pointed area on the bottom portion of the ulna. So we also have we have two notches here, a trochlear notch, which is the area that's going to fit around the trochlea, and then the radial notch where the radius will fit into it. So let's look at these parts. Okay, so again, looking at the ulna, we know our elbow is called the olecranon or olecranon process. That's this whole area up here that has a trochlear notch that actually fits around the trochlea, basically on the anterior side of it. Then we actually have a little bit of a process here called the coronoid process, which is going to fit into the coronoid fossa. Okay, we have this styloid process of the ulna, which will be on the opposite side of the styloid process of the radius. And this little thing right here forms that little bump in your wrist right above your pinky. So if you feel a bump kind of on your wrist, below your elbow but above your pinky, that's what you're feeling is the styloid process of the ulna. Okay, so the ulna also has a radial notch where the radius will fit into it. It has a head, which will be the opposite of the head here, and it has that, of course, that big trochlear notch. So let's look at the trochlear notch again, the radial notch, and the head of the ulna. Okay, so here's the trochlear notch, okay, that big groove that fits around the trochlea. But we also have a notch down here on the ulna that the radius fits into, so that's the radial notch. So remember, the ulna has the radial notch, the radius has the ulnar notch. You wouldn't say ulna has an ulnar notch because that wouldn't tell you what fits in it. But the ulna has a radial notch, so we know it's the radius that fits inside of there. Okay, so whereas our radial head was up here, our ulnar head is down here on the opposite side of the styloid process of the ulna. So styloid process one side, the head on the opposite side. And again, our styloid processes are kind of opposite of each other on these two bones. Okay, our hand has three regions, the carpals, metacarpals, and phalanges. In previous videos, we already talked about the metacarpals being those bones in the fleshy portion of the hand, the phalanges being the bones of the fingers. Okay, so if you're not sure about that, make sure you go back and watch that. So, but what we want to talk about now are actually the carpal bones. And I've put another video in that explains this from a slightly different perspective. Just make sure when you're trying to learn these, you use one mnemonic or another, but don't mix your mnemonics. Okay, so I'm going to show you these bones the way that I normally teach them to give you a way to figure out, these 8 bones, because they're really not that difficult if you use a mnemonic to figure them out. So let's look at that. Okay, so looking at the hand from this perspective, understanding these are our metacarpals, but these are the 8 carpal bones. Notice the upper row of bones, the first 4 bones, all basically border or come close to the radius and ulna. But they don't touch any of our metacarpals. But our lower 4 bones all border our metacarpals. Okay, so in teaching this, what I like to do is give a little saying, and goes like this: some little tiny people, and this pisiform bone is that bone that you can actually feel above your pinky area, and it kind of protrudes out. So it sits on top of, the pisiform sits on top of the triquetrum, also can be called the triangular bone. So if I give a little saying, some little tiny people, I've just described the first letter in the upper row of bones. And then if I start back over on the thumb side, because I always start on the thumb side, and I say try to chew ham. Now I've just put these bones in order: trapezium, trapezoid, capitate, hamate. So I will do this little portion of the video over, since we're almost out of time on this video, to start the next video and make sure you know the carpal bones. And then I'll put an accessory video there for you to look at in case you don't understand my method of doing it.